Do your feet ache like you've been walking on broken glass? Hi, Dr. James Vegher here. I'm a specially trained doctor of physical therapy who focuses on helping people solve their joint pain issues. Today I want to talk to you about why you might be having pain in your feet. But I also wanted to give you even more help. So stick around to the end of this video to grab a copy of my free Healthy Foot and Ankle Guide. I created this free gift for you to learn more in-depth tips, strategies, and exercises that will heal your joint pain fast. I recently got a comment from someone saying heel spurs are affecting their walking pattern, making it difficult for them and even painful. Heel spurs happen when calcium builds up under the heel bone, but don't always cause pain. In fact, bones and joints are shaped by how they are pulled on. This usually occurs from muscle, but can happen because the bone is being pulled on by a ligament or fascia. So to understand heel spurs better, we have to look at the plantar fascia, which is the big band of tissue connecting your toes to your heel bone. The plantar fascia is designed to absorb shock and provide stability to the foot. But if there is repeated strain, it can lead to pain in the foot and is typically associated with plantar fasciitis. Repetitive strain and excess tension on it can cause inflammation and irritation, which lead to pain. And more specifically, this irritation can be because your fascia is too long from constant strain and can't do its job, or it is too short and your foot is putting constant pressure on it to try to get the foot into a normal position. You might think if you have repetitive foot pain, there's no fix, especially if you're constantly on your feet. But the reality is, we need to retrain the muscles in your foot so that they're not putting the repetitive strain on the same areas. I want to show you a simple stretch you can do to stop foot pain in its tracks. First, you need to know that this movement is intended for a broad audience, and you may require more specific attention. Also understand that if I was working with you one-on-one, I would be able to provide treatment and guidance on all of the facets of your pain. There is much more that goes into solving your pain problems that encompasses your whole body, and I encourage you to check out my other videos for a more comprehensive approach to solving your pain problems. Now, if you're experiencing severe foot pain, you need to seek one-on-one medical attention. Let's get started. So as I mentioned earlier, there are two main things that could be happening with your plantar fascia. Either it's too long or it's too short. So the exercise that I'm going to show you next works on both sides of that. So if you're doing this and you have pain going in one direction and you don't have pain going in the other, just stick with the direction that reduces your symptoms. You do not have to do both. Most people find that doing both directions is really beneficial for their pain, but if going in one direction is painful, just eliminate that direction and practice going in the other direction, the direction that's pain-free or pain-reducing, and practice that until your foot is pain-free, and then you can bring in the other direction. So you have a complete exercise for your foot. So you do this exercise in standing, so we're gonna start in standing. And there's nothing really special that I need to tell you about what to do with your foot. It's well beyond what you need to be doing with this simple exercise. So, first part, we're gonna be moving forward, and the key here is not allowing your heel to come off the ground. So I'm gonna curl my toes to pull my heel along the floor, and I want to curl my toes as far as I possibly can get them, and then unfold the toes out so I have a nice normal foot posture. And then do the same thing on the other foot, and I'm going to do it 5 times going forward, curling the toes underneath. Now, we're gonna move backwards. So we've gone forward, we worked on shortening the muscles and the tissue on the bottom of the foot. Now we're gonna work on lengthening that tissue out. So I'm gonna start this time with curling my toes underneath me, lifting my heel, and then trying to lengthen the bottom of the foot along the ground as I step backward. This exercise is gonna take practice for a lot of people. It requires lots of concentration and coordination to try to get your foot to move in this way, but keep up the practice, get your foot to accommodate to being used normally so you can get that pain to go away. There you have it. Be sure you listen to your body and stop immediately if you experience pain. Pain is your body's way of telling you something is wrong. As promised, I have that gift for you. All you have to do is click the link down below in the description. It will take you to a page where you put your email in, and within minutes, you'll have your free healthy foot and ankle guide right in your inbox. If you learned anything helpful, please share this video and click that thumbs up button. I would really love your help with leaving me some feedback down below in the comments too. If you're new here, hit that subscribe button so you can get more tips and tricks to fix your pain. Until next time, take care of yourself.